Hello, my name is Adam. I am doing a video on a dressing change to a PICC. So before I enter my patient's room, I'm going to look at their MAR, gather my supplies. While looking at the MAR, I'm going to look at their name. Her name is Mary Smith. Her date of birth is 5/18/1963. I'm looking at allergies. She has no known drug allergies, and I'm seeing that this is the time that she has a treatment, which is her dressing change to her PICC. And all this, now that I'm ready, I can enter the patient's room. Good morning, Mary. My name is Adam. I'm going to be your student nurse today, and I am coming in to do a dressing change to your PICC. I'm going to shut our curtain here to give us some privacy. Can I get your full name and date of birth? She tells me Mary Smith, 5/18/1963. I look at her band that she has, and that checks out, 5/18/1963. Mary, do you have any known drug allergies of any sort? She says she has no allergies at all. So all allergies, no known allergies. Are you have any reactions to any cleaning solutions of any sort? She says no. So that's good. Okay, Mary, so we are going to, like I said, change this dressing to the PICC. I'm going to make sure, let her know that it's a sterile procedure and make sure that she's able to follow commands. So she is able to do so. So Mary, during this procedure, I'm going to have you wear a mask. This is to maintain sterility of our procedure. And if they're unable to do so, I'll have them turn their head away from the procedure, the entirety of the procedure. So here we're just putting on gloves. I'm gonna put on my mask here, and then we're gonna also give her mask. So here we'll just go over. Okay, she said that that's okay. Okay. So next thing that we're gonna do is we're gonna go 6 inches above where the insertion site is to her PICC, and here I have a tape measure. We're going to tape measure around her arm here, and what this is that I want to make sure that it's the same circumference as it was last time. This is to see if this was a change, if it's a ½ an inch difference than the last one, especially larger, it'll be indications of possible phlebitis, maybe the PICC line infiltrated, or even dislodged. So everything looks good there. Next, we're gonna take off our old dressing. So here, we're gonna start from the outer side and go in towards the insertion site. Also, noting that our hub is in place for stability. I'm going to look at my old dressing here, and I'm going to assess it for any color, odor, consistency, and then the amount of consistency. There isn't any, so that's good. Next, I'm going to assess the site, the insertion site around it, where the PICC is inserted. Looking for any redness, edema, ecchymosis, any drainage, and then the approximation as well, and it's well approximated, so everything's good. I'm going to palpate the area, asking Mary, is there any tenderness at all around your site? And there's no tenderness at all, so that's good. So next here, we're going to remove our gloves. I'm going to wash my hands again. Here, we're going to prepare the sterile fields. Got my gloves, sterile gloves. Noting that the outer 1 inch perimeter is not considered sterile. Okay. So here I'm going to use either a alcohol swab or a iodine swabs. Here I got an alcohol swab. So we're going to start in a circular motion from the center here, kind of work out here. We're taking off any blood or any drainage of any sort. You know, rotating here, using all my swab. If I need a second one, I can throw away, get another one. So we'll throw that. Next here, we're going to use our ChloraPrep or whatever your agency protocol is. Aseptic is whatever, as long as it's aseptic. So here is our ChloraPrep. We're going to pop this here, snap it. Here we won't in this case, but you would. And then you're going to do causing friction. You're going to go up and down and across. You're going to do this for a good 30 seconds here, doing a 2 to 3 inch border. Okay. Okay, once your time is up here, you're going to discard that. Okay. Waiting for it to dry. Okay. So next we're going to use some skin prep. And here we're going to make a little window around, because this is where our dressing is going to go. This will help secure our dressing. Okay. Okay, and we're letting that dry. So here we're going to take off our sterile gloves now. We can discard them. Okay. I'm going to wash my hands. We're going to put on some clean gloves here. I'm checking with Mary, see how she's doing. She's doing okay. She said she feels fine. Says I'm doing a great job. Okay, next we're going to be putting on our transparent dressing. Some agencies have like a CHG film that they'll put on. Here we're just going to put on a transparent dressing here. Also noting that I'm putting on my initials on here and the date, so we know when this has been changed. Throw that. So here. Stretch. We're going to make sure that this is nice and tight on here. I'm going to take out this outer piece. It's kind of an old dressing. Securing it tightly here, that's good. Okay. So what else I have here is that we're going to want to secure our tubing as well. So here you can put on a piece of tape, and you can, and got my name, the date, and the time that this dressing is changed as well. So this can go right here, like that. Okay, so after this I can remove masks here. Now that we got everything covered, we can remove masks, remove gloves. I'm going to clean up my area. Ask Mary how she's feeling. Says she's feeling great. So after we clean up our area, I'm going to ensure safety with my patient. Make sure that they're comfortable, give them their call light, bed rails up, low bed, floor mat. Alarm is on the bed. And I'm going to make sure as well that I'm going to document this. So what I would be doing, documenting, is the date and time that we changed this, how it went, noting if there was any, any reader or coca, as I'd mentioned earlier, if there's any drainage and all that, and also possibly a change in circumference on her arm as well. Lifespan consideration would be, obviously, I'd have to note lifespan consideration. A lifespan consideration would be having the parent in with the child if we needed to. I'm doing this. I don't have one. This concludes my video.